Good afternoon. Thank you very much for joining me. And this was a slightly, I guess, cryptically titled session for today, Tips for Cat Care That Your Vet Wish You Knew. This was a topic that I was asked to comment on some time ago. And I have to admit that it's still work in progress because I think there are many more things that could be added to this list. But this is a starting point. And I did think it was perhaps a useful topic because there often are assumptions that I think vets and vet nurses make when we see our cat owning clients that perhaps we shouldn't make. And I would be very interested to hear your thoughts and comments at the end as well. So please do feel free to give me feedback, suggest more tips that you think should be included. But the ones that I thought of really, first of all, centre around understanding cats and being the best sort of cat owner, if I can put it like that we possibly can be. And we all know that cats, of course, are fabulous pets. We adore cats. This is why you're here, I'm sure, and this is why I'm here. But they are not very domesticated in the big scheme of things compared to dogs that have lived with people and are much more pack animals, so have a very different attitude towards living with people in homes. Cats still are, from an evolutionary perspective, not very domesticated. Sorry, I'm just mispressing a button trying to admit someone from the waiting room. And therefore, I think we do really need to understand what a cat is and therefore what their needs are so that we can make sure that we provide that in our home so that they are as happy as possible. And there are some great resources out there actually on this topic. And the charity International Cat Care, that probably many of you know of, has a veterinary division called the International Society for Feline Medicine, ISFM, and they have produced a number of sets of guidelines. Sorry, I'll just mute a couple of people joining. They have produced a number of guidelines on different topics, and one of those sets of guidelines is actually on what they call environmental needs for cats. And these guidelines are free to access and often endorsed by the American Association of Feline Practitioners, which is the other acronym at the bottom of this slide. AAFP is the American Association of Feline Practitioners, ISFM, International Society for Feline Medicine. And if you just Google ISFM consensus guidelines, you can find a huge list of guidelines on various topics, but these environmental needs guidelines are useful for the first set of tips really, which is understanding what is a cat, what keeps a cat happy in the home. And one of the charts in this paper I've included here, which is the 5 pillars of a healthy feline environment. So for a cat to feel happy in an environment as a pet, it needs to feel safe. It needs to have access to what we call key resources. That's things like food, water, a toileting area, which might be a litter box or access outside, scratching areas, play areas, and areas for hiding and resting. And those key resources, it's really important, particularly if we have multiple cats, that we have multiple resources. So there is not competition for access to those resources, and especially important in situations where perhaps our cats don't love each other quite as much as we would like them to. So I'm going to be talking more about that actually next month when we talk about stress in the home, how we can understand the dynamics of different relationships in our groups of cats. But if you do have several cats, you need to have plenty of resources. Ideally, the key resources should be 1 per cat and 1 extra if you can. So if you have 2 cats, having 3 litter boxes would be ideal. And a key thing also that's mentioned in that little box is that they're separated. So you don't have 2 or 3 litter boxes next to each other because that is one toileting area. There have to be 2 or 3 separate toileting locations for those cats. Pillar number 3 is play and predatory behavior. So cats, as you know, are predatory creatures. They are very hardwired to want to hunt, catch, prey, and that's very much in their genes and inescapable. So we need to accommodate that somehow in the home. So providing opportunities for them to do that, and or allowing them to go outside and be able to do that. And then pillar number 4 is also really crucial, which is what sort of way we interact with our cats. And this should be predictable, so the cat really knows where it stands. It should obviously be positive from the cat's perspective as well, and very consistent. So what can be difficult, I will admit, is households perhaps like mine, where I have children, quite young children, and they want to play with cats. And we have these 2 gorgeous kittens. They're a bit larger than the photos on the slides now. And the children are desperately keen to pick up the kittens and play with the kittens. But from a cat perspective, that is perhaps not ideal, because we want the cats to choose when they want to interact with us rather than us making that decision for them. And we want them to feel in control of that interaction. And so we want to be, as it says here, very consistent in our behavior towards the cats. And the last pillar is respecting the cat's very sensitive sense of smell. So avoiding very overpowering perfumes, air fresheners, scented candles that are very strong in aroma from a cat's perspective is probably desirable to them. Food and water bowls. Cats tend to prefer metal, glass and ceramic to plastic. So that's another little tip that behaviorists would often have. And we should separate the food and water bowls. So not as shown in this picture here, where there is a water bowl right next to a food bowl. The two should be separated, because cats, again, from an evolutionary perspective, prefer to drink from water sources that are far away from their food, because in the wild, their water source close to food might be contaminated by where they had killed that prey species. So they want clean water. So they tend to prefer those two being separated. Optimal toileting facilities is another, I think, linchpin for our cats. And for our cats that are indoor only, of course, we have to provide a litter box. But I would argue that all cats, even those with free access outdoors, should have the opportunity to use a litter box should they prefer that. Particularly, I think, for elderly cats, where going outside can become a little bit more difficult for them if they have to go through a cat flap and they're a little bit arthritic, or perhaps a little bit forgetful as well. They having a litter box in the area they spend time in is useful. And if you could ask a cat what sort of litter box it would like, it would want to have a litter box that was large enough for it to be able to turn around and have a good old dig in. And many commercial litter boxes, unfortunately, are not very large. So the ideal measurement in terms of length would be that the litter box should be 1.5 times the length of the cat from its nose to the base of its tail. And of course, when you get your kittens and they're little, a little litter box is fine. But as your kittens grow, then their litter box needs to get bigger. And for those adult cats, it needs to be bigger. And unfortunately, often what happens is that the larger the litter box that is commercially available, they tend to also be deeper. And that can cause problems with our older cats. Again, if they have to step over a large lip to get into their litter box, then that's quite challenging for them. And so these lovely photos at the bottom were actually shared by Ada Mayer, a regular attendee of these sessions, so Poppy and Figaro, and their home designed litter box, which as you can see has this lovely low access point, so it's very easy to get in and out of, unlike some of these really large deep trays that you can get commercially. I think Poppy and Figaro do get on very well, in which case it's absolutely fine probably to have one cat sitting on top of the litter box. But this is an example of a situation where if you did have multiple cats and they were not always best friends, you absolutely need to have multiple separate litter boxes, so that if the cat feels a bit intimidated going into their litter box when one of their housemates is sitting on top, which is perfectly understandable because cats like us like privacy when they're using their bathroom, then you need to make sure you cater for that. And cats do tend to prefer a very sandy consistency litter. I really like using clumping litters as well, because it's very straightforward to keep them clean, but also you know then precisely, particularly if you only have one cat, what is being passed. So you know that your cat is doing, for example, 2 urinations per day. So if anything changes and there's either no urine in the tray or there's larger, more numerous clumps of urine, then you know that there is an issue. And some of the sort of posher litters that are available that you don't need to change, that are very absorbent, you just don't get that sort of clinical information. Cats love high up places, so I think that's something that's good to support where possible. Of course, as they get older, access to those high up places might get more difficult and a little bit of assistance might be required. So a chair that the cat can jump onto to get onto the windowsill, for example, might help. Some steps or ramps even in those arthritic cats can also be helpful. But in your young little cats, having a bed on the top of a cupboard can actually be completely accessible to them with their great agility. These climbing frames also that you can get are very popular with cats. They have also that range of hidey holes and different beds, as well as raised areas. Cats just really love being high up. And they definitely love having an opportunity to hide. So this is a favorite resting place at the moment for our cats in the home. This is a cupboard in one of my children's bedrooms. You can barely see in the left-hand picture that there is a cat. There's a lovely fleecy blanket here, and Nala lying on top of it, quite happily snuggled in there. And then as I was taking photos and enjoying seeing her there, she turned around to say hello. So being able to support hiding is, I think, a positive thing. Some cats will like going underneath beds if that's an option, and they definitely like to have places where they can feel they're undisturbed and can escape from whatever they want to escape from. So what about diet? What sort of tips for diet can I give you? Well, I think a broad tip that I would give you is this first one, which is to always feed as good quality a diet as you possibly can. There is quite a lot of research that has been done on dietary requirements of cats. For example, we know that they're obligate carnivores. They have to have some essential fatty acids and amino acids that are only found in meat. So a cat cannot have a vegetarian diet unless it's been synthetically created and added to with these essential fatty acids and essential amino acids that are only found in meat sources. But we also know that good quality diets tend to be associated with better health. And there's some nice research recently, for example, that shows that cognitive function, so brain function in elderly cats and dogs, feeding them a higher quality diet that tends to have more antioxidants, more fatty acids in it, does have a beneficial impact in terms of their brain function. So feeding as good a diet as you can is one recommendation. The kittens were being fed with a puzzle feeder, which is a nice way of having a little bit of activity, making them work for food a little bit, making it a little bit easier rather than just sitting and wolfing down particularly dry food. But there are other decisions that obviously we need to make. Again, another really key thing would be that at least the bulk of the diet, if not all of the diet, should be a complete diet. A complete food is one which has been checked and is known to meet all of the cat's nutritional requirements. So it's in other words, it's balanced to provide all of the protein, the minerals, everything that the cat needs. There are other things that we can choose to feed in addition to our complete diet that are what we would call complementary items. So things like your dreamies, the huge number of different treats that are available, but also some delicious little select pouches and other things that we can get from our supermarkets and pet stores. Actually, if you look at them, they will say they are designed to be complementary. So they're designed to add on top of a complete food, but they are not completely balanced. So make sure that you do look for a diet that is complete as your broad baseline diet. There's always a lot of discussion as to whether it is healthier to feed a dry diet versus a wet diet, or indeed a mixture of the two. And there are, I think, are lots of points for comment there. And there are many animals that do brilliantly on a dry only diet and many animals that do brilliantly on a wet only diet. The proposed advantages of a dry food are better dental hygiene, so keeping the teeth a little bit cleaner. Also, in a practical terms, particularly if you live in a warm country, feeding a dry diet can be more practical than wet food, which can go off very, very quickly. But then in an older animal, and certainly animals with certain health problems, we might want them to have a wet food so that they are taking in more water, because we know that actually cats on a dry food do not drink as much fluid, as much water as they would take in if they were eating a wet food. So there are pros and cons. With kittens, it's a good idea to make sure that they're familiar with both formats, just in case you need to change their diet at some point in their life, even if you do decide that you want to predominantly feed one formulation rather than another. There has been a lot of interest recently in raw feeding of cats and dogs, and that might be something that some of you are doing. Again, just be careful to feed a complete diet, ideally a diet which has been checked that it is actually balanced and appropriate for your cat and their life stage. There are some controversies with raw food, of course, that people do worry there is a higher risk of certain infections that are normally eliminated by cooking. We did in the UK a year or two ago have actually a small outbreak of cats developing tuberculosis from eating food that, or suspected to be due to eating food that had been from infected venison carcasses. And so that certainly is something that I think anyone who is going down the raw feeding pathway needs to know and understand. And there are some good resources that can help in that decision making as well. So the bottom of this slide, you can see I've put perhaps choosing a food that is made by a company that is a member of the PFMA, that's the Pet Food Manufacturers Association. And this their website has a huge amount of resources on it, and I think they estimate that yes, I think it says here 90%, if I'm reading correctly, of pet food companies are registered members of the PFMA. So most manufacturers see this as a positive thing to be a member of this organization that accredits really and certifies that the food is complete and balanced, and they have some really good resources there. For example, if you are interested in raw feeding or grain-free diets, there are some information resources available. Certainly as a clinician, I would say in general terms, I don't encourage feeding a home prepared diet to cats because it is incredibly difficult to produce a home prepared diet that is balanced. So my preference would always be for a commercial cat food where possible. I just genuinely think that is the safest thing to do. If you ever did want to feed a home prepared diet, then it is possible with support from a veterinary nutritionist, and there are some vets who are very specialized in this area, and I refer people to them for that sort of advice. So people like Marge Chandler, who I've worked with, and some of you may have heard her speak as well. She's a very, very well-known veterinary nutritionist, can assist with that. But in general terms, feeding, I think a commercial diet is sensible. So that's enough about food. Next on the list was actually a real bugbear of mine as a vet, which is cat carriers. May not sound a very exciting topic to talk about, but any of you that have taken your cat to a vet clinic will have probably experienced some of the challenges that accompany that, one of which is getting the cat into the carrier and taking the cat to the clinic, and then at the clinic getting the cat out of the carrier so that it can be examined by a clinician. And there are lots and lots and lots of different cat carriers available on the market. And unfortunately, not all of them, in my opinion, are really suitable for this purpose. For example, the lovely wicker basket shown on this slide on the right-hand side is probably quite a nice, snuggly place for the cat, and might be a comfortable way of being transported. For example, this cat is going to a boarding cattery or traveling further distance. But in terms of the vet assessment, as you can see, we've got quite a small opening, which is quite difficult to get a cat out of. And unless the cat wants to come out of that opening, it could be quite difficult to get them out in a way that's not distressing or uncomfortable for them. And particularly key, of course, would be if the cat ever injured itself, getting them into this carrier and getting them out of that carrier could actually be difficult. So the more boring carriers that have a large top opening are much more practical. They are, less attractive to look at, but I'm not sure that the cats really bother about that. There are a lot of carriers that are like this burgundy coloured one on the left-hand side, which are quite easy to dismantle. And if you have a carrier like this, where it really is actually very easy to take the top off, then those are brilliant. But some of these design ones, unfortunately, they're quite fiddly to get the lid off, and it can be, really quite stressful doing that in the consultation. So ideally, it's something that either has a large top opening or is easy to dismantle, obviously easy to clean as well, but avoid the sort of ones with a small opening that are impossible to dismantle. Something else you can do is actually train your cat to go into their cat carrier, and this is not as impossible as it might sound. International Cat Care charity I mentioned a little bit earlier on actually have a series of videos with their behaviourist, Sarah Ellis, explaining how to do this in a series of steps, and it does work particularly well for cats that love treats. So if you have a cat that they absolutely love their dreamies and they really respond to treats, then you can actually train them to do certain things. So in these series of videos, she actually talks through how to train your cat to first of all sit on a specific pad of bedding, which is ultimately going to be in the carrier. So there's no walls or anything hemming it in, and then you move from that to the blanket inside the carrier with no door on the front, and then progress to the door going on. And the idea is really just to make the carrier a non-threatening place, a place that the cat doesn't feel upset about being in, so that hopefully they might think, like Nala here, well, if the carrier is left out, yeah, well, I might decide to go inside, and that's fine. I don't find that it's scary or threatening, even if I manage to shut the door on myself, as she's done here. It just is somewhere that is not scary. And in line with that would be the recommendation that to keep the carrier at home in a location that the cat spends time in. So rather than the cat carrier perhaps being stored in your garage, your shed, your attic, and it comes out once a year, for it to be just a normal option for your cat to use as a hiding or resting place. Perhaps just take the door off, perhaps even take the lid off this one. Next tip is finding a good vet clinic, and there are of course lots of really brilliant vet clinics, but something that has changed in recent years is an ability for vet clinics all around the world to actually accredit themselves as being cat friendly. And cat friendly is this term that was invented by International Cat Care to really refer to understanding and knowledge about cats that translates into the highest possible care for cats. And they have an accreditation scheme whereby clinics can go through an application process to either be a bronze, a silver, or gold, gold being the highest level of cat friendliness. And on the Cat Friendly Clinic website, which I've put here, but if you just Google Cat Friendly Clinic, you'll find it. You can see that one of the options under the cat owner menu is to find a cat friendly clinic. So if you click on there, you can then enter your location and it will tell you what cat friendly clinics are in your area, and you can find a little bit more about them. And the idea is really that clinics that have gone through this, and you have to go through this process, I think, every 3 years. So it's not a once and then you forget about it. It's a sort of continual process. But clinics that are registered as being cat friendly have firstly a certain baseline of equipment that is relevant to cats within the clinic. So certain laboratory and clinical equipment. The highest level of clinics have to have separate cat facilities and larger kennels in the hospital ward for sick cats. So there are certain very strict criteria that have to be made, and hopefully that has an impact on our cats, and that supports them during their visits to the clinic, but also if they have to stay in the clinic. Because we do know that although cats are good at lowering our blood pressure, they're good for our stress levels, they are actually a little bit of stress bunnies themselves. They're quite, I would say, control freaks in general. Cats really like to be in control of their environment. And if we take that sense of control away, which is typically when we take them into a vet clinic, then that can be extremely stressful for the cat, as you probably are very, very aware. And that stress can have an impact in the short term, what we would call acute stress, short-term stress, but also in the long term in chronic stress. So for example, if we have a cat that needs to be hospitalized, it's very ill, it needs to stay in for several days, then the stress associated with that can have a negative impact on their recovery from illness. In the short term, though, it also has a massive impact because there are lots of things that are affected by stress. Of course, the cat's behavior can be affected. Some cats, when they're fearful, will become aggressive. Many cats actually don't do that. They are sometimes frozen with fear. They turn into little statues, but their heart rates increase, their respiratory rate increases. Sometimes that causes open mouth breathing, so a cat panting like a dog, which is quite distressing, I think, to see, as well as to experience, I'm sure, for the cats. Also can have an impact on some of our measurements. So for example, blood pressure measurements. In people, we know stress can increase blood pressure, but the same is true in cats as well. What we sometimes call the white coat effect, the stress increase in blood pressure. The more correct term nowadays is something called situational hypertension. So situational being that in certain situations when the cat is stressed, their blood pressure goes up. Their heart rate, their cardiac output, the amount of blood the heart is pumping, the body temperature can all increase, blood glucose can increase, and that can make it difficult, particularly if we're trying to assess a cat and we're wondering if it's diabetic, which also can cause an increase in blood glucose. We can get an impact on our white blood cells, so the hematology, the blood profile, and the leukogram, looking at white blood cells, can be affected. The urine pH also can be affected. So all these things can be a real problem to us as clinicians because they can interfere with our ability to make the correct diagnosis and provide the correct treatment. And then, as I've already mentioned, for our cats that need to come into the hospital for treatment, stress often can reduce or cut off appetite completely, can slow healing, can affect drug metabolism. So overall recovery can be really compromised. So it's really important to us as clinicians to be cat friendly, so that we are able to firstly assess our patients and get an accurate diagnosis. We get the correct diagnosis, we then use the correct treatment, and also our patient hopefully is going to recover more quickly. So cat friendliness is really key for us. But we're also recognizing more and more that it is key for you as well. It's key for the carers. And some of you may have participated in a questionnaire that we ran. Actually, we launched it about a year ago today, called our Happy Cats survey, looking at the stress associated with a visit to the vet clinic. And we've generated a lot of results. About 400 people participated in this extremely long survey. So thank you very much for your support with it. And we're still analysing. We're going to publish these results, so we will share them in full properly as soon as we can, but just to share some interim findings with you. Firstly, just overall, how stressful did owners rate the consultation was from their cat's perspective? This is the time spent in the consulting room. Well, the answer was that 3/4 of owners said that it was either moderately or severely stressful, sort of maximum score. So for 3/4 of cat owners, they recognise that the experience for veterinary examination, time in that consultation room, is extremely stressful. And unsurprisingly, witnessing stress is actually stressful to us as cat owners as well. And so when asked this question, does witnessing stress have an impact on you? About 95% of participants said yes. Only a small number of people, 4.5%, said no. And even those people generally in the free comments section were saying, well, I know it's stressful, but I also know it's the right thing for my cat to receive their treatment, particularly if they're ill. You know, it's really important that they get it. So that's how I cope with it, which is, of course, very understandable. But the fact that more than 90% of people are saying, you know, this is stressful is, of course, concerning to myself. And we also know that witnessing stress does have an impact on future behavior. So, for example, in our survey, we asked, has witnessing stress ever put you off a vet visit, a future vet visit for your cat? And we found that just over 30% of people said yes. And again, everyone participating in this survey is a really dedicated cat owner. And the comments we got in line with this were along the lines of, for example, with vaccination, if an annual booster is recommended, some people are choosing to just stretch that interval a little bit, perhaps to, rather than 12 months, it's maybe 13 or 14 or 15 months, which is allowed by the vaccine manufacturers, just to reduce that vet visit frequency a little bit. So it's definitely an important topic. So being cat friendly is really, I think, important for the cats, but it is important for you, I believe, as well. A little bit more data here. So a previous study that showed that decision making for vaccination was impacted by stress associated with a vet visit. So 27% of owners said that stress during a vet visit was a very important factor when deciding whether or not to vaccinate their cats. So it's not necessarily just thinking, is the vaccination a good idea? Do I believe in vaccines? But actually also thinking, or do I want to put my cat through this stress? And an American survey with, I think, about 2,000 cat owners, about 40% of them said that just thinking about a vet visit was stressful for them. And I can relate to that as well with certainly some of my cats where it's been really quite stressful taking them into the clinic. And as you saw, our survey has indicated about 30% of owners had said that witnessing stress puts them off a future vet visit. And clearly that can't be a good thing for care in terms of receiving, you know, accurate early diagnoses and appropriate treatment. So it's something we need to work on. We need to do a better job. And lastly, being cat friendly is really important for clinicians. So for the vets, the nurses, the receptionists all working in the vet clinic, because if we do have a cat friendly environment, it's going to make our job a lot easier to do. We're not fighting with our patients. I would never recommend fighting with a cat anyway, but you know, if we have a calm, empathetic manner, we're working as a team, it's a much more pleasant process. We're much less likely to have any sort of injuries, which of course do happen in vet clinics. And certainly clinics that go through the cat friendly clinic accreditation process report that there is greater confidence in dealing with cats, greater job satisfaction, and ultimately it's better for the clinic from a business sense as well to be cat friendly. So this is something that I'm delighted to say is widely adopted. So if you're wondering if your clinic is cat friendly, you can look that up on the cat friendly website. They should have the cat friendly clinic logo in a prominent place. That is something that's supposed to happen with practices that are accredited. But of course, there's often lots and lots of things up in waiting rooms. And at the moment, we're not letting people into waiting rooms, so it can be difficult to tell. But having that accreditation is a good step. And also all clinics that have cat-friendly clinic accreditation have to have a nominated cat advocate in the clinic. This is often a nurse, not always, but that person is the sort of go-to person. So if you have worries about your cat's ability to cope with a vet visit, you're concerned about any aspect of care relating to your cat, then asking to be put in touch with the cat advocate can be a useful first step. So a few final little tips to finish with. One is that more and more, certainly in the UK, healthcare plans are becoming extremely popular and I think very helpful part of helping us to provide good preventative healthcare for our cats. So you may have one of these already. If you've not heard of these before, they are typically, what they involve is a monthly payment to your vet clinic or to a provider, and that covers the vaccination, the worming, the flea treatment, and sometimes all of the consultation costs as well. And so it helps to just spread those routine costs through the year, and typically provides discounts for it as well, because of course it works well for the clinic to have that regular income. So it may discount surgical treatments or medical prescriptions. So I think that's a useful thing to consider in terms of spreading the costs. The other thing, of course, to consider is pet insurance. And again, this is available in many but not all countries. And the main reason I think for pet insurance is really dealing with those unexpected large costs that can arise. Just because cats are small creatures, unfortunately, doesn't translate to the bills that are possible with veterinary care being small. And as every year goes by, there are new treatments, there are new diagnostic facilities that potentially add to the cost of investigations. And so individual health conditions sometimes can cost thousands of pounds to manage in some situations. And it's horrible if money comes into the decision-making equation, which of course it often does to some extent or other. But pet insurance is one way around that. I do know other people that have savings plans, that they have a sort of special savings pot for their pet expenses, and that works well for them. Insurance, of course, is always a gamble, because if you are lucky and your cat is healthy all its life and you never claim on its insurance, you might think, well, why did I spend all this money on something I never used? But the main utility is really for those sudden emergency large bills that might otherwise be difficult to cover. Preventative healthcare, and thinking more of older cats here, the senior health checks are now becoming a more common recommendation in clinics. And I would say, if at all possible, if you have an invitation to attend a senior health check in particular, then I would say always say yes, if at all possible. At the moment, again, with COVID, there may be less availability of these sorts of consultations, although some clinics are doing some online consultations to cover some aspects of these. Of course, you can't examine a patient online, but we can still collect that detailed information from you regarding your cat's health and contribute to their well-being and their care. But many old cat illnesses do develop quite gradually, quite insidiously. They can be difficult for a carer to spot at home, whereas these preventative healthcare checks, where the animal is thoroughly examined, is weighed, there's that thorough discussion, can help to pick them up at an early stage. And the earlier the diagnosis in general, the better the treatment outcome is. So if you do receive an invitation to a senior clinic, then I would say very much do your best to attend it. And if you do have a cat that is particularly anxious about vet visits, then make sure that you do have a chat with your vet clinic, because there are some options now in terms of things that can be done to reduce the stress, and those a mixture of things which include, if the clinic know in advance, choosing a quiet time of day for the cat to come in if they're very stressed by other animals. But also there are some vet visit sedative options which we are using more and more and finding helpful. For example, a painkiller called gabapentin, which is not a veterinary licensed medication for cats, but we do sometimes use for cats with orthopedic and other pain. We also know has some sedating side effects, and this has now been studied by a number of researchers, and using a higher dose of gabapentin prior to a vet visit, a higher dose than you would use for its normal pain relief, often will just sedate the cat a little bit and really help to facilitate the sort of examination that might be needed. So if you have a very stressed, very anxious cat, then ask your vet clinic about gabapentin, and that might be an option that is helpful. There are some other medications that are also used in a similar way, but gabapentin is probably the most frequently used. And then a couple of very final recommendations for you are, I would say, always trust your instincts. So you are the person that knows your cat best. If you think there's something not quite right, then almost certainly there is something that is not right in your cat. So don't be deterred from contacting your vet clinic at any point. And in fact, that's the last tip as well. Always ask your vet clinic for advice and support, because that is what they want you to do. They want to be there for you, and you are registered with them for a reason. And when it comes to healthcare, of course, I would say a veterinary clinic is the most important, the most appropriate port of call. So a slightly sort of random, possibly slightly shambolic discussion of my tips for pet owners, but I hope of interest. I would love to hear what else you think should be on the list of tips, things perhaps you wish you knew before something happened in your cat's life, and that you wish your vet had told you about. As always, there's a lot of other information on the website, recordings of previous sessions. So this is actually more or less a year's anniversary that we've been doing the Cat Cafe sessions. And if you look on the video tutorial page, which is under the helpful info tab of the homepage, you can see all of the previous Cat Cafe sessions. Next time I'm talking about stress in the home, how we can understand as carers, or how we can get some clues whether or not our cats are stressed at home, and of course what we can do about it. So some of the discussion today about resources, providing those key resources in multiple separate locations will feature, but also some specific tips on how to recognize stress in cats. And very finally, before I open up discussions, I mentioned the Happy Cats survey during this presentation, but as always, we have got some ongoing surveys that are open. And the one we're doing, the biggest push for at the moment, is giving medications to cats at home. We've had an absolutely amazing response to this survey, so thank you so much if you have already completed that survey. But if not, we would still love to hear from you and your friends and your relatives and anyone else you know that has a cat. And if you go to the survey page of the website, you'll be able to see Medicating Cats is one of the surveys that is open. It takes about 10 or 15 minutes to do, but we would really love your responses, and we're planning on closing that survey at the end of April, so just a few weeks left to respond to that. And similarly, we have a little bit more time for the Feline Acromegaly survey. This is definitely a more niche survey. Acromegaly is a condition where a brain tumour overproduces growth hormone, and typically affected cats are diabetic with a very severe form of diabetes. But if you have had experience of that in any of your cats that you've owned, or if you are a clinician, any cats that you've managed, then there is an owner survey and a vet survey that you can link through to from our website, which are still open again for just a few more weeks, and we would love to have your responses to that. So thank you very much. I will now be very happy to answer any questions or take any comments that you have. I'll have a look in the comments box. Thank you.